Have you ever wondered if your legs have the strength they should? Or if the fatigue when climbing stairs is normal with age? There is a simple 30-second test that gives you the answer immediately. It's called the chair test, and it detects early signs of sarcopenia, the muscle loss that affects 1 in 3 people, especially after 60. Sarcopenia is not just less strength, it's the gateway to falls, frailty, and ultimately dependence on others. Detecting it early is crucial. In this video, I will teach you the correct technique to perform the test, how to interpret your result based on your age, and the 8-week protocol to reverse your leg weakness. You only need 3 items: a chair without arms of normal height, about 45 centimeters, your mobile phone timer, and 30 seconds of courage. The correct technique is: sit in the center with your feet flat on the floor, shoulder width apart. Cross your arms over your chest as if hugging yourself. You stand up completely, extending your hips and knees, and sit back down with control, without letting yourself drop. That's 1 repetition. The challenge is to do 5 repetitions in a row. Synthetic speed doesn't count here. Control is what measures strength. If you have doubts about balance, do the test near a wall. After doing it, ask yourself, how long did it take you to do the 5 repetitions? Write it down. If you couldn't complete them or needed your hands, that is also useful information. Less than 12 seconds? Excellent. Your muscle strength is fine. We are in the prevention zone. Between 12 and 15 seconds? Attention zone. It's not urgent, but it's time to act. More than 15 seconds? Or if you couldn't finish? Clear sign of muscle strength loss, early sarcopenia. This is not prevention. It is time for intervention. Why does this simple test work? Because standing up from a chair requires power. And that power comes from the largest and most vital muscles in your body, the quadriceps and the glutes. This test not only measures strength, it predicts your future risk of falls, correlates with your total muscle mass, and anticipates your functional capacity in the coming years. If your result was high, more than 15 seconds, the goal is not to become an athlete, but to regain independence. I will give you an 8-week protocol with 3 clear phases. Phase 1 is activation, weeks 1 and 2. We start gently, with 1 rest day per week. 1. Supported squats. Sit down and stand up from the chair, but touch a table with your hands if you need to. This is not cheating, it is progression. Do 3 sets of 8 repetitions. 2. Extra walking. Walk an extra 15 minutes every day. 3 5-minute walks count. Consistency is key. 3. Stairs safely. Add climbing stairs twice a day, slowly and safely. Nothing heroic, just small habits. Phase 2. Progression, weeks 3 and 4. Now we remove the aids. 1. Unsupported squats. Try the squats without using your hands. If you can't, stay 1 more week in the previous phase. There is no rush. 2. Mini squats. Bend only halfway as if you were going to sit down, but stay halfway. Do this 15 times in a row. 3. Single leg balance. Practice balancing on one leg, leaning against the wall for 30 seconds on each side. Phase 3. Strengthening. Weeks 5 to 8. It's time to consolidate and challenge the muscle. 1. Squats with resistance. Repeat the chair test every week, but now add weight. Use a water bottle in each hand. The important thing is not the weight, but maintaining the technique. 2. Lunges. Take a step forward, bending both knees without moving, and return to the starting position. This is easier to see than to explain, so pay close attention to the image. The critical component is protein and nutrition. Without enough protein, all this work is useless. Exercise is the work, but protein is the bricks to build the muscle. You need a minimum of 1.0 to 1.2 grams of protein per kilogram of body weight per day, distributed across your meals. 2 eggs for breakfast, chicken or fish at noon, legumes or meat at dinner. Also, consume protein after exercise, Greek yogurt or a glass of milk. Warning signs you should not ignore. If you could not complete the 5 repetitions, if you lost your balance, or if you had to use your arms to propel yourself, you need a medical evaluation. The chair test is an early alert, not a complete diagnosis. Distinguish between normal muscular discomfort from effort and acute pain in the joints. If something is wrong, consult. In summary, you have an early signal about your muscle strength. If it took you more than 15 seconds, it's time to act with specific exercises, sufficient protein, and a lot of consistency. Let me know in the comments how long it took you and your age. This creates a real reference for the entire community. And if this video has given you useful information about your health, share it with someone who needs it. Like it and subscribe for more longevity secrets.